Chronic liver disease. From the name, chronic liver disease means the deterioration of liver functions within a long period of time. If you remember, I said about acute liver disease is the deterioration of liver function within short period of time, but chronic is the deterioration of the function of the liver within long period of time. Okay, so what happens in chronic liver disease and what signs and symptoms does the patient has when he has chronic liver disease? As usual, I will start with normal functions of the liver, and from this point I will explain what happens in chronic liver disease. Let's assume that this is the liver. Okay, the first function of the liver that we mentioned is dealing with bilirubin. Okay, bilirubin is the result of destruction of red blood cell. Okay, if we have chronic liver disease, that means that bilirubin will not be dealt with. The body will not excrete bilirubin, so the levels of bilirubin in the body will be increased, and that will cause what we call jaundice, which is a yellow discoloration of the skin and sclera. Yellow discoloration of skin and sclera. I will show you a graph of jaundice here. Okay. Oh, hurry up. This is jaundice, a yellow discoloration of skin and sclera. Okay, the jaundice level can give you an indicate of how bad the liver damage is, and the progressive, okay, how progressive is the disease at the level you are in. So this is the first clinical sign of chronic liver disease. The second function of the liver, we mentioned that the liver is responsible of making albumin, which is the most important protein in the serum. Lacking albumin will lead to what we call edema. Could be generalized edema, lower limb edema, or whatever. Okay, this is edema. In addition to edema, lacking albumin will lead to what we call leukonychia. Leukonychia is the white discoloration of the nails. As you see here, white discoloration of the nails. It can be benign leukonychia due to trauma or anything, but one of the causes of leukonychia is the liver failure. So this is about albumin. The third function of the liver is synthesizing coagulation factors. Coagulation, or just say clotting factors is easier. Okay, clotting factors. And liver failure will make no clotting factors. Lacking of clotting factors will lead to what we call coagulopathy, and the coagulopathy in this situation will manifest as what we call bruising. Bruising. Okay, bruising. This is bruising. Okay. This is about clotting factors. I think I mentioned the three synthetic functions of the liver. Now let's move to the metabolic function of the liver. We said that one of the most important metabolic function of the liver is dealing with hormones. Just choose different color. Is dealing with hormones. So bad. Hormones and drugs. If you remember, I gave estrogen as an example of hormone liver deal with or liver metabolize. In liver failure, the liver can't get rid of estrogen, and increasing estrogen level in the body will lead to many sexual and vascular problems. One of the sexual problems is hypogonadism. Hypogonadism. Okay. The second one is gynecomastia. That the male patient will have a breast, have a female breast, gynecomastia. Okay. Increasing estrogen level will lead to another vascular problems, but this is not for sure. But some late studies say that estrogen increasement will lead to what we call spider nevi, and pulmonary erythema. As a result of increasing estrogen, the blood vessels will dilate, and that will lead to spider nevi. Spider nevi is a dilation, or it is a spider shape dilation of the blood vessels in the distribution of the superior vena cava, head, neck, upper limbs, and the trunk, and the back sometimes. Okay, pulmonary erythema is a reddening of the thinner and hypothinner. Let's show you spider nevi. Okay, where is the photo? Okay, this is spider nevi. This is the nevus in the center, and this is the spider shape. The nevus, by the way, is an dilated arteriole, and the spider lines are venules that get out of this nevus. Okay, let's show you the pulmonary erythema. This is pulmonary erythema, reddening of the thinner and the hypothinner of the palm, reddening of thinner and hypothinner of the palm. Okay, I just draw another photo so that will be clear. This is the liver, and this is the portal vein. portal vein. Okay, one of the most important functions of the liver is getting rid of bacteria and foreign antigens that come with portal vein. So if we have liver failure, this bacteria and foreign antigens will stay here and stay in gut, and increasing the bacteria will lead to fever and increasing some foreign substances or harmful substances like ammonia will lead to what we call hepatoencephalopathy. Hepatoencephalopathy. Okay, what is hepatoencephalopathy? It is loss of memory and confusion, okay, personality changes, and could be coma, this is the final stage, or it could be change in sleep pattern, etc. Okay, the important thing that increasing ammonia will lead to what we call hepatoencephalopathy. Increasing bacteria will lead to fever. Fever is not only caused by increasing bacteria in liver failure, but also by some inflammation process or inflammatory process happens in the liver when it fails. Okay, this is the second cause of fever in this case. Also, the derangement of the portal circulation will lead to portal hypertension. Hypertension. And we will talk about portal hypertension in separate video, but now I will say that portal hypertension will lead to ascites and esophageal, okay, just varices, and splenomegaly. Okay, just show you some portal hypertension ascites. This is ascites due to portal hypertension. Okay, and this is esophageal varices. You know, esophageal varices is the result of stasis of blood in the esophageal venules, because as you know, the left gastric artery is one of the left gastric vein is one of tributaries to the portal vein. Okay, and that have some link to the esophageal veins, and that will lead to esophageal varices, and we'll talk in details about that after a few videos. Okay, so these are, and as you know that the liver is the home of protein metabolism, when there is a liver failure there will be protein, okay, just protein catabolism. catabolism, and that will lead to muscle wasting. Muscles wasting. Okay, I will show you here a muscle wasted man. This is a patient with end-stage liver cirrhosis disease. Demonstrate muscle wasting. Here you can see muscle wasting and ascites, as you can see. Okay, the final signs or group of signs of liver failure is cardiac signs. Cardiac. Just call. Okay. Cardiac. In what we call hyperdynamic circulation. Hyperdynamic. Okay. Make circulation. So what is hyperdynamic circulation? I will not talk about the pathophysiology of hyperdynamic circulation. I will just mention that hyperdynamic circulation includes first thing is high cardiac output. High cardiac output. And the second thing is low blood pressure. Low blood pressure, because it causes decrease in the resistance of blood vessels. So blood pressure. The third thing is high pulse or large pulse. Sorry, it's too different. Large pulse, and what we call pounding pulse. Okay, pounding pulse. So this is hyperdynamic circulation. As you see, it is easy to expect. Okay, I just forget to. Flushing extremity is one of the things in hyperdynamic circulation. Flushing extremities. Okay, you will see red face or extremities, for example. Okay, so this is all about the signs and symptoms of chronic, or just signs. I think I didn't mention any symptom actually. So these are signs of chronic liver disease, and you can expect them from the function or the functions of the liver. It is quite easy to understand and not just repeat and recall. No, you have just to understand the functions of the liver, and from the functions you can know what signs can happen. See you in the next video. We will talk about classifying the severity of a chronic liver disease. Thank you.